Well, good afternoon, everyone. I'm Matt Morrow, President of the Springfield Area Chamber of Commerce, and I know we have a number of people on the call today joining us, and there may be still a few more to join as we move through the call today, but I want to be respectful of your time, and I really want to welcome everyone to today's call. We have a great program lined up for you today, very timely, highly relevant for employers in our community in particular, and I'll introduce our speakers in just a minute. We appreciate your engagement on the virtual programming that the Chamber's been working to offer during this pandemic and in the recovery phases as we've been working through that, even as we all have been trying to adapt to rapidly changing realities. And we appreciate you turning to and trusting the Chamber of Commerce for your business guidance during this time. We take that very seriously and work to try to make sure that we're providing highly relevant content for you. We have a lot to cover today, and we have had a number of questions already submitted in advance. I want to thank you for that. Many of those questions came from you. Some came from people who aren't even able to join us on the call today, but we'll listen to it later. And we'll try to get to as many of those as we can. And in addition, if you have questions that come up during the course of today's conversation, I want to encourage you in real time to contact us about that so that we can get to those if at all possible. You can email your questions to Lauren Musto on our team. Her email address is lmusto@springfieldchamber.com. That's LMUSTOE@springfieldchamber.com, and we'll do our very best to get to those questions even as you send those to us in real time during the program today. Today begins the start of Phase 3A in the City of Springfield's Road to Recovery plan. Springfield has continued to lead the region in recovery efforts, but it is a road. It is a significant path, complicated along the way by a number of factors, not the least of which are the latest health metrics. And as we look forward in a COVID-19 world, we're still faced with many uncertainties, but the leaders who are with us today are really doing all they can do to try to make sure that our recovery for business and individual Missourians is as strong as possible. And we've packed an agenda pretty full today with a lot to get to. So I'm going to introduce our guests now. With us today, our City of Springfield Attorney, Rhonda Lusader, Assistant Director of Springfield Greene County Health Department, John Mooney, and Julie Cummings, who is the Chief Human Resources Officer at BKD here in Springfield. And I want to thank all of you for being on the call today to talk to our members and to provide some insight and guidance into the next recovery phase, as well as maybe providing some best practices for businesses so we can learn from each other a little bit in this setting as well. So Rhonda, if I could just jump right in, I'd like to start with you. A lot has happened with public policy along the way to try and slow the spread of the virus in our community. And most recently, of course, Monday night, City Council passed a masking ordinance. In a moment, John's going to talk a little bit more about where we are as a community in terms of containing the virus and how that mask ordinance is intended to assist in that. But for now, if you could, could you please provide a little bit of an overview for us of this latest 3A phase that the council has adopted? Specifically, I'm sure the masking ordinance is of significant interest, but just anything in this new phase that you think might be relevant to people.
Okay, thank you. So the ordinance is the main part of this phase, and it covers three areas: CDC social distancing, face covering requirements, and occupancy limits. The CDC social distancing applies to pretty much every business or non-for-profit organization. The requirement in that section is to follow CDC recommended social distancing to the greatest degree possible. I believe right now that's 6 feet distancing. If a business or organization cannot follow CDC recommended social distancing, they should comply with the face covering requirements of the ordinance. It's important to note that the face covering requirements do not apply to every business, and that they apply only to the parts of a business that are open to the public. So let's go through the face covering requirements. First of all, a face covering is any device that covers the nose and mouth. It could be homemade, such as wrapping a scarf or a t-shirt over the nose and mouth, as long as they're both covered. The ordinance also refers to a public accommodation, and that is defined rather broadly as any business, public and private, indoors and outdoors, open to and used by the public. It's going to include obvious activities like retail and some things that may be less obvious, like transportation services and schools, except higher education. It's important to note that face coverings are only required by the ordinance in the parts of a public accommodation open to the public. So if a business has areas not open to the public, like a warehouse or manufacturing area, the ordinance does not require masks in that area. The ordinance also includes a list of exceptions to the face covering requirements, such as children under the age of 3, people who have health conditions which make face coverings unsafe, people who are hearing impaired or communicating with persons who are hearing impaired while you're eating or drinking, people receiving services that require the removal of a face covering, such as dental work, people exerting themselves in sport or exercise, people working in a setting which increases the risk of heat-related illness, and people outdoors who can maintain at least 6 feet of distancing from anyone who isn't a member of their household. Another aspect of the ordinance is occupancy limits. These are mostly the same as the limits from the mayor's emergency proclamation. There are 2 major differences though. The first is restaurants, which will no longer have an occupancy limit, but must keep groups of diners at least 6 feet apart unless a solid barrier is placed between tables or booths. The second difference is that businesses which were defined as non-essential in the mayor's proclamation no longer have an occupancy limit. In fact, the ordinance doesn't reference essential and non-essential businesses at all. Both individuals and businesses can be penalized for violating the ordinance. Fines for violating the masking part of the ordinance are capped at $100 for both individuals and businesses. The ordinance specifies that businesses are not in violation of the ordinance if they have a policy of requiring face coverings per the ordinance, but a patron refuses to wear one. Businesses that refuse to comply with the face covering requirements, by not implementing the requirements at all, or not requiring them for their employees when they should, could face suspension or revocation of their city permits or licenses. And the fines for violating the parts of the ordinance that don't relate to masking, such as the occupancy limits, are the standard city code penalty, anywhere from $0 to $1,000 fine, and or 0 to 180 days in jail. I think it would be pretty unlikely that jail time would be imposed by a judge for that type of violation. So that's kind of a brief overview of the ordinance.
So Rhonda, thanks so much for that. And one of the things that as it became evident that there was going to be a vote on a masking ordinance in Springfield, we did here at the chamber really begin hearing a lot from business owners about their concerns regarding compliance. And you covered a couple of the key points there, but I wonder if we might explore that just a little bit further in terms of what that means for businesses in our communities. A couple things that really jump out at me. One, I know there's an exception for if you're outdoors and 6 feet apart. It sounded like at the beginning, if I heard you right, that the requirement to mask, does that only happen when you can't meet other social distancing requirements, or is that a more universal requirement than that?
So I think you're referring to the CDC and
Yes.
social distancing. That's just that applies to every business, not just the masking requires only to businesses which are also a public accommodation.
I see. Okay.
But yeah.
So in the context of compliance, I think a lot of the questions that we received, and you touched on this too, is there's certain things that a business has authority over their employees. They can require their employees to wear masks. They certainly can make clear through probably signage or in other ways that there's an expectation that everybody in the place will follow the city ordinance. But there were quite a few who are concerned about, well, what if I have a customer who just refuses to wear a mask, or what's my responsibility at that point? And I think you really provided some important clarity in the ordinance about that.
Right. So, one thing to make clear is that businesses that simply refuse to comply with the ordinance could be penalized, as
Right.
I mentioned. But the ordinance is also clear that businesses will not be punished for having customers that refuse to comply. Businesses should let their non-compliant patrons know that there is an ordinance in effect that requires the masking, but the ordinance does not require businesses to refuse services to those patrons. And it's the business's choice if they want to call 911 or make a complaint about it. They certainly can, but they're not obligated to under the ordinance.
Okay. That's really, I think that was really helpful just to get that clarity, because there is there's a lot of concern about how far they should or could go. And obviously businesses can go further than is required of them in terms of what they want to do to keep that compliance in place. But They just need to know what a good faith effort kind of looks like, you know.
Yeah, and so, and as you, I think it's an important point that if businesses choose to go further, they certainly can. I saw an announcement earlier today that Walmart will now require masking of customers. And so that's certainly a choice that businesses can make. But in terms of violating the ordinance, as long as they're generally requiring it, they don't have to be concerned if they just have a non-compliant patron.
Okay. I know City Council has been hearing lots of opinions about the adoption of this ordinance, including some pushback. They heard from a lot of community members who were able to express their concerns or their support for the ordinance on Monday night at the meeting of City Council. Because, of course, public policy is never developed in a vacuum, I wonder if you might talk a little bit about the process that took place to draft the ordinance, to engage community input, maybe some of the discussion, medical guidance, other considerations that went into the drafting of the ordinance.
So my part in drafting the ordinance was to take the policy that Director of Health Clay Goddard and his team had thought through and put that policy in writing. So I'm going to defer to John Mooney, who could provide more information about stakeholder input, medical guidance, and other considerations.
Yeah, Matt, you want me just to hop in on that one?
Yeah, I know you were dealing with this a lot over the course of the last couple of weeks, John. Go right ahead.
Yeah, sure. So, of course, in public health, our approach is typically that we would prefer to have a lot more time to develop the public policy and to be able to seek a lot more input. Obviously, with things with the pandemic, normal approaches don't always apply, and so with that in mind, everything's sort of on this shortened time frame and a sped up process. But anytime we're going to suggest or make recommendations around public policy, we're still going to follow a lot of the same tenets. And so first thing that we did with this was to conduct a lot of research around the scientific evidence around masking, and to be able to come to a conclusion there to make sure that we feel comfortable with what's being recommended. We're also doing quite a bit of looking out at other communities and see what has been experienced and what do those ordinances look like to really pull apart which parts that we think are going to be most effective and most appropriate for our community. And then, of course, we're going to be seeking input, and what we did was seek input from multiple communities. Obviously, healthcare, we want to get that health lens on that, so we certainly want to get their input, as well as other community leadership input on that. And that's in addition to all of the feedback that, of course, council got after they had a draft of that ordinance. And I think that was pretty well documented on Monday night, just the amount of input that they heard from the community. So it was certainly something that I know from our standpoint, we certainly tried to engage with the community to make sure that voice was heard as well.
So, John, I know there have been a lot of factors that go into crafting a policy like that and really trying to understand how best to put something like that together, or whether there's even a need or when the timing is right on it. Obviously, a big part of that are health numbers. I know our cases have risen in recent days. I also know that case count alone doesn't really tell the whole story. So I wonder if you could talk to us a little bit about maybe some of what's been happening, maybe an update on where things stand from a health perspective for our community. I know you've been in it up to your elbows and then some for quite some time. What kinds of proactive measures are being taking place locally to try to contain the spread of that virus? In addition to the masking, that's one ingredient in a pretty complicated recipe. So maybe you could talk us through that a little bit.
Yeah, so a few things on that. So first, let's talk a little bit about just where the numbers are. I think anytime I have a chance to talk to groups, I want to make sure that we're dealing with the most current information that we've got. So on our dashboard, which I would refer people back to on our website, and that's springfieldmo.gov, and you can find all sorts of links and information on the coronavirus. One of those is the recovery dashboard. But right now on that, we're reporting 588 cases. Unfortunately, we've already added an additional 20 cases since that was updated this morning. That or more will be added later this afternoon. And to provide just a little bit of context of how that compares with where we've been just a week or two ago, which it's actually been increasing over the last about a month, I would say. We've had a higher rate of disease. But just a week ago, we had 414 cases. So just in a week, close to 200 new cases. 2 weeks ago, we had 314. So we've doubled in just a 2-week time frame. So we have more than 300 cases that are currently active. And the number that really is concerning to me as well is just the number of people we have in quarantine. We have more than 600 people that have been in close contact with those cases. And what that means is that 600 people, we've got more than 600 people that might be incubating disease. And so we certainly have a lot of risk that's still coming in the next 2 weeks potentially. So in that 2 weeks period, we've also issued public notices where people have been out in the community while infectious to more than 90 places, which is obviously a lot of concern for us, because what our concern with those is that it leads to that community exposures. And as a byproduct of that, and just people not being aware that they have the disease, either that they're out while they are pre-symptomatic or asymptomatic, we've seen 22% of all of our cases over the last 2 weeks have been associated with community spread. And that's the biggest category of cases that we've seen are related to that community spread. Additionally, I would include that the region has more than 4,000 cases. I believe it's up over 4,100 cases right now. So it's not just active within the region, but certainly active here. And all that's produced is a reduction in our public health capability. And so again, if you're familiar with our recovery dashboard, which I won't go into all of the details of it, but one of the important points on that is our public health capability score is down to a 1.6. And really what that means, we're exceeding our capability to be able to keep up with new cases as they come in. And so that slowed down our response time. And so our gold standard is to be able to investigate cases within a 24-hour period. And we have not been able to do that for about the last week. And what that means is it's taken us longer to get to people that are sick and taking us longer to get to the contacts, just because we don't have the capability to keep up with all of the new cases coming in. So our concern then is that slowed down response leads to more disease, and the more disease there is, the more likely there's going to be hospitalizations, and that's what we really get concerned with. Two is that if that hospital capability drops and they're not able to respond to new cases, that's when we kind of get into a worst case scenario. And so that's what we're all trying to work towards from a health standpoint to help prevent that.
So it seems to me like one of the reasons that our numbers certainly have been on the rise, and the strain on the system is clear. We're still, it seems, if I'm reading it correctly, beating the curve with a lot of peers. Yeah. It feels to me like probably that to date, the ability to do that very aggressive contact tracing may have been what has helped us to this point. Is it more than that, or is that an accurate assessment?
No, so that is certainly a piece of that, and I'm glad that you brought that up. That was one of the other things I actually wanted to touch on there with that, is that our community has responded in amazing ways to this. That I think when we're tested as a community, we come together and come up with great solutions, and this is no different than that. Through the first 3 months of this, and I haven't been able to look in the last week or two, but we have been one of the best performing communities in the nation our size. So when we look at rates of disease across communities our size across the country, in a county that's roughly our size, we've had the third lowest rate of disease through the first 3 months of this epidemic. When we look at just Midwestern cities, we've actually had the lowest rate of any city greater than 100,000. And I say that to say there's no way that there's one particular thing. That's been a great community response, from the willingness to comply with a stay-at-home order, which I know was an incredibly difficult thing to do, to really taking good protective measures as we step back out. I think all of those have been key components, along with public health and healthcare and increasing our capability and be able to respond to those timely, have come together to create a strong response. And where we are now is we need the community to continue to come together and sort of have a recommitment to taking the steps that we can all take to help slow the spread of the disease.
Of course, the health department's doing what you can do too. My understanding is bringing on some additional staff to help expand your capacity for contact tracing. Any thoughts on how soon that staff will be on board? It may take a little time.
Yeah, so we have been working pretty hard, and we got approval from City Council on Monday night to add 37 new positions. We'd already had a few things in the work, just hoping that was approved. Unfortunately, it was approved. And we've actually been able to move forward that we've already offered several positions and have some accepted positions already. So we're hopeful to have them come on here in the next couple of weeks. As well as we have a lot of positions that are open and doing interviewing. We were also working on an additional contract to give us more capabilities with that contact tracing. So we're hopeful within the next few weeks to month that we can further expand our capability even higher. So as we have the rates of disease like we're having right now, we hope that we'll have additional capabilities that will be able to continue to respond and get back up to that standard of 24 hours that we really want to maintain.
Thanks so much, John. I want to turn now to Julie. Yeah. Julie Cummings is the Chief Human Resources Officer at BKD. Julie, I know a lot of questions and challenges for employers during this time, things that were pretty hard, if not impossible, to anticipate how best to be ready for right now. A lot of responsibilities fall on employers to ensure the safety of the workforce, the safety of customers, vendors, yet it can be really overwhelming to know where to begin. I know one company that's done a tremendous job of implementing great practices to protect your employees and your clients is BKD. And so I wonder if you could share just a little bit of what has worked well for your organization that could possibly serve as a best practice for others who might be listening in today.
Sure, thanks. I'm happy to share some of the things that we have done. Matt, I think one of the key things that was important to us in this process was we understood that probably our biggest challenges is not only were we trying to combat some of the impacts to productivity and revenue loss, but we were also having the impact on our workforce and where's their well-being and what anxiety do they have in this unknown area. So, we really took the track of being focusing on a large degree of transparency and communication with our employees, making sure that as we were having conversations, not just the decisions that were made, but as we were having the conversations about what we were considering and contemplating, that we were sharing that back with our workforce. And a lot of that came in the tone at the top with our CEO sending weekly video communications to the entire firm. As we've got 40 offices in 18 different states, and so that was our best way to communicate and be able to be transparent in here's where we're at, here's what we know, here's our commitment to you, to make sure that they understood as the decisions were being made and what the outcomes were going to be. They knew kind of what was leading up to that. So I would say our communication and our transparency was very top of mind and really had a significant impact in our workforce's ability to really stay engaged and focused on, making sure we're meeting productivity standards, that we're keeping ourselves safe. And so really beyond regular communication updates, we also created a website to keep track of office-specific information, as well as we wanted to be able to provide resources and guidance that could be helpful for our employees. And so that particular website, it's, of course, the COVID-19 site, and it includes information about how to stay safe, how do we support working parents and getting creative now in that era of, okay, they became the teachers, and how do you work effectively remotely, and best practices to consider and how to do that, and how do you stay engaged in working with your coach to make sure that you're addressing your needs and your concerns and the challenges that you're having, and working remotely, working through having to be a parent, teacher, babysitter, you name it, while trying to be productive. It also had supporting information with regard to personal and financial well-being resources for mental health, and then and guidance for how to work effectively with clients. We moved from meeting in person to meeting virtually, and there are some things that can go wrong in those types of transitions when we're having video calls, and so really being able to make sure that our people are set up effectively, have confidence to be able to conduct themselves in working with clients, and a number of areas as well. And probably what was most impactful as we started working on the strategy of bringing people back in the workforce is really focusing on a reentry survey to our workforce, and that would educate us on several factors with regard to individuals' ability to be able to come back to the workforce safely, given the environment that we create. How is their well-being? How comfortable or anxious do they feel about that? Do they volunteer to come back? And or if they can't come back, what are the restrictions that are keeping them from being able to do so? And that really populated our knowledge with regard to where our workforce was at. And so as we began that reentry process, we really focused on who were those people that volunteered and wanted to come back to work. And then we started with that group of people, and we ensured that we had the right educational process to be able to get that moving, starting with that volunteer workforce. So those are some of the things that we focused on. Probably the biggest was just being very transparent with our workforce, and there were a lot of unknowns, and we just came out and said, we don't have the answers to these questions yet, but here's where we're moving and here's why. And so our workforce responded very positively to that. And I think it showed a level of, I guess, we're bringing them along in that decision-making process.
And it's a work in progress. I mean, constantly kind of evaluating and repositioning and trying to be as on top of it as you can be. But at the same time, the ground shifts pretty rapidly. So are there any specific policies that you might recommend or that employers might consider in the event of an actual outbreak in their place of business? Heaven forbid, but that does happen sometimes.
It does. And actually, I think absolutely, whether it's a policy or guidance, I think employers need to have a plan in place in case there is an outbreak or exposure. I think that's what John was just mentioning, is that we're having increased exposures. What do we do with that? What do people need to do? We need to make sure that we equip them with the knowledge of, if you're exposed to somebody who's positive or you indeed test positive, what's the process that we go through, and what's our commitment to our workforce to keep people safe, and why is it that we're having you check in as you come in the building and check out as you leave, and let us know what areas of the building you're in. So there's purpose and reasons for that. One of the things that we did not have, that through this process we quickly put one together, and that was the infectious disease policy. We did not have one, and we felt that this was a great time to do that. So we leveraged a number of resources and developed in short order an infectious disease control policy that includes our focus to prevent the spread of infection in workplace, as well as steps employees should take to protect our workers. We defined reporting process, and we included guidance in other areas such as, our travel restrictions, confidentiality of medical information, how we handle accommodation requests, as well as how we handle non-compliance. And so we wanted to treat this as, hopefully we never are faced with this again, but it's not just going to be a COVID response policy. It is indeed going to be an infectious disease control policy. And so that was one of the things we quickly adopted. We also created, as we began the reentry process, the world is very different within the BKD walls now. And as we bring people back, we needed to make sure that they understood how things were going to be different, and the expectations of that. And so we created a short training course that reinforced the new policy, but it also required completion of this training before they could even come back to the office. So each of our offices, we also placed posters with guidance on social distancing, at room and elevator maximum numbers, a myriad of posters. I'd say probably 7 or so posters, everything from how to wear a mask and how to socially distance yourself, pathways, the directional pathways to walk. We conducted orientation meeting with those individuals who were going to be coming back to work. We covered this training, we answered questions, to ensure that they understood what those expectations were and how we were going to, as a firm, keep them safe and keep their safety top of mind, as well as I think John even mentioned, our community really steps up. We're in this together mentality, and that's really what we took. We talked with our workforce and said, we're in this together. Here's our commitment to you. Here's what we need you to do for us. Making sure that you're adhering to the mask wearing, the social distancing, letting us know when you're coming and going and things of that nature. And we've had a lot of success with that. Right now we're still on the volunteer reentry process. And so we've had quite a bit of success, and those specific policies and the training that we've provided, I think, have really, it's reduced the anxiety, I think, from our workforce, wondering how we're going to keep them safe. And they know that we're serious and that we're committed to this, and we will hold people accountable. And I think that that's diffused anxiety, but it's also built a level of trust with our workforce that hopefully we all expect.
Well, that's very, very helpful. And we've covered, I think, a good amount of ground here. I will also share with you, we have probably about 25 minutes left, and we have a lot of questions from our members. They're coming in real time. And so again, if you have a question and you have not had a chance to submit it yet, please do email that to us. You can email it to Lauren Musto on our team. That's L Musto, LMUSTOE at springfieldchamber.com. And so we have, I'm going to try to get through as many of these questions as we can. We have them from manufacturing sector, from banks and credit unions, from restaurants and retail, preschools, churches, hotels, professional services. And there are others as well. And so many of them are very specific to the masking ordinance. We want to make sure we provide good intel for everybody so that they can take good action in their business. So here's what I'll say. If there's a quick answer to one of these, give us the quick answer. If there's not a quick answer, then just be as efficient as you can so we can get through as many of these as possible. I know you will, but sometimes these are fairly complicated questions as well. So while we have you here, let's go ahead and jump into these. Many of the questions have to do with either compliance or enforcement. Some have more of an HR component to it, but let's just kind of jump right in if we can. And this is probably, my guess is Rhonda, John, some combination will be the right ones to answer a lot of these questions. But let's just start with an area that's pretty familiar to a lot of people. If you're and that's the restaurant setting. So if a customer comes into a restaurant, just a question from a restaurant owner, a member of ours, and that customer is unmasked and they offer to sell them a disposable mask and they either refuse to buy it or refuse to wear one, then what's the next step? I think we covered this earlier, but I just want to make sure we've got it. The question is, are we required to refuse to serve them, or can we seat them anyway? We don't want to put our staff at risk of a confrontation with customers. And then in a related way, what if someone says that they have breathing problems or a hearing impairment, or one of the exceptions that's a part of that? Is what's the role of the business in that setting? In this case, specifically talking about a restaurant dealing with someone who might be in that situation.
So regarding the first part of it, a business is not going to be penalized under the ordinance if it has a general policy requiring face coverings, but a customer comes in, refuses to wear one, the business offers one, the customer refuses it. The business isn't going to be penalized. The ordinance does not obligate them a business to refuse to serve an unmasked customer. So they can seat the customer if they choose to do so. It's beyond the scope of the ordinance, but a business, possibly could refuse to seat them, although they would need to consider issues of, if the customer's is complaining about a medical issue, they would need to consider if they need to make a reasonable accommodation.
Mm-hmm.
Completely understand businesses not wanting to put their staff at risk for confrontational encounters, and that's why we're not penalizing businesses for customers who refuse to comply. If the customer claims a breathing problem or hearing impairment, all I can say about, can you refuse to seat them? The ordinance doesn't require someone to wear a mask with a health condition that would be harmed by wearing a face covering. It doesn't require someone with a hearing impairment to wear a mask. So, in terms of refusing to provide seating, it's not a requirement of the ordinance. Can a business choose to do so? I'd probably suggest that the business talk to their own private legal counsel about that.
What about in a setting where maybe there's a reception area in a business? So that's public. People can come in from the public into that reception area, but the receptionist is seated behind a glass or plexiglass screen. We had a question from a business member who has a receptionist answering phone calls, talking to customers who might come in the front door, but they've provided a glass barrier. Are they also required to mask even behind the glass barrier?
That's an interesting question. If it's complete, I would say if it's completely enclosed, I would consider them in a different area than the area that's open to the public. But if you're talking about, I've seen places where they have barriers they're kind of like a spit shield, to use that term. So they're a few feet tall, but then they would be open above, and in some cases below. There might even be a speaking hole in them sometimes. I would say that they're still in the open area, because they're not completely in an enclosed space that's not included in the open area. So those folks should definitely be masked.
Okay. What about, so there's some, I think a lot of questions that are about, what constitutes a public area, what's, where is that required and not required? So for example, if I have a meeting in our conference room and we're 6 feet apart, do we need to wear our masks while we are sitting in that meeting 6 feet apart if it's not in a sort of a public access area?
No, you would not need to, because that area is not open to the public, at least, during the time that you're having an employee-only meeting.
Okay. We've actually had a number of questions from manufacturers who have questions about, do manufacturers have to have face masks in non-public areas? Maybe what constitutes a public area? What about a lobby? What if the lobby's closed, or if it's just by appointment? Does social distancing need to be implemented in common areas such as lunchrooms, for example, in a manufacturing space? And I guess any guidance that John and or Rhonda might be able to provide on that probably would be helpful to a number of people too.
So in terms of the distancing, there is that part of the ordinance that says, to the greatest degree possible, businesses should implement the CDC guidance on social distancing. If it's not possible to do that distancing, then the ordinance says they need to try to distance at least 3 feet and comply with the face covering requirements of the article. But the thing that you have to keep in mind is that the face covering requirements of the article only apply to the areas open to the public of public accommodation. So when you take the example of some kind of manufacturing facility, and they have, the area where they're, for example, doing machining or something like that, it's not open to the public. There's no masking requirement there. So, they should try, to the greatest degree they can, they should try to distance. That's not just a requirement of the ordinance, it's just good sense right now, in order to try to prevent an outbreak among their employees. But they're not required to mask in those non-public areas. Now, if they have a reception area, an area where the public's allowed to come in, then yeah, they need to mask there, including employees. If it's open only by appointment, then I would say it's only open to the public during those appointments. So anyone who's in the area that's open when somebody comes in for an appointment should mask. If it's not open to the public because they lock the door behind their appointment, and now the public can't come in until the next appointment, I would say it's not open to the public during that time.
So that last answer, actually, Rhonda, sounds like it's maybe the answer to a question we received from one of our nonprofit members, which is it's my understanding that employees aren't required to wear masks while working in our office, but then when visitors to the office come, that's essentially that crossover into public. Visitors are public, so they're required to wear masks, and then presumably, I guess, anybody meeting with the visitor would also be required. Or is there maybe a further requirement than that?
No, I think you have it right. So
Okay.
if, while they're, if they accept appointments into their office, somebody comes in for an appointment, then the person, the staff member who's meeting with the patron, and the patron should be masked. If otherwise no member of the public is in there, it's just all staff members, there's not a requirement that they be masked.
So one of the things that I find kind of interesting about this, about kind of the shift that's happened over the last few months, is many banks and credit unions had policies, requirements posted on their doors that no one could come into their lobby with faces covered. That's so that they could get a clear picture of their face on the security cameras in case anything wasn't the way it should be, obviously. And so one of the questions is, would banks and credit unions be able, is it an option for them to require customers to remove the mask long enough to get them on camera before allowing them to come into the bank, or do they need to just keep that mask intact the whole time?
I mean, if the ordinance doesn't really address that, I can't imagine prosecuting someone or a business because they had somebody lower their mask for a few seconds in order to get a photograph of their face. As long as they're generally compliant with the ordinance, I can't see. I think that the city would exercise discretion not to pursue that. One other thing I might mention, Matt, is there is one exception to employees not being or having to mask in areas that aren't open to the public, and that's for the preparation of food and drinks that are going to be served to the public. There is a requirement in the ordinance that staff must remain masked while they're preparing food and drinks.
Okay, that's very, very helpful. And actually, there was we received a question from a preschool member of the chamber, and they were asking about the specific requirements related to younger children, maybe under the age of 3 or between 3 and 11. I wonder if you could clarify that a little bit, what those requirements are.
Well, children under the age of 3 are exempt from wearing a mask, and there's a safety reason for that. Children under that age may have difficulty removing the mask if they begin to experience trouble breathing. So children from the ages to 3 to 11, the ordinance strongly encourages that they wear a face covering, but they're not required to while they're under the direct supervision of an adult.
The preschool teachers required to wear masks, I assume?
Yes.
Okay. So obviously a whole lot of questions from a lot of different kinds of businesses. We had several from hotels and motels, and one of the, I think trying to get to the kind of the gist of it and consolidate those as much as I can. There are questions about if you have a group that has rented or leased time in a ballroom, a hotel ballroom, to have an event or a program of some kind, and they're observing social distancing. The hotel has made clear what the requirements are of the ordinance, even informing the contract signer that we're requiring masks. Then I guess the same thing is true. If they come and in spite of all of that, somebody or some group of people are not observing the ordinance, the ultimate responsibility for that and the ultimate accountability for that under the law is still the people who are breaking the ordinance, right?
Yes, as long as the hotel or whoever's leasing that space has a policy to require masking and they've made that clear, then it's ultimately the individuals who are violating it who can be penalized under the ordinance. Now, if they've leased, for example, a conference room to another organization, that organization possibly could be penalized if they choose not to enforce or not to require masking at all, but the hotel would not be responsible. Okay.
And then presumably if someone might be required to wear a mask to check into the hotel, but once they're in their guest room, right, everything that's like being in your house or on your own, you're at that point fine. Okay.
Yeah, that's not an area open to the public. It's reserved for particular guests.
Okay. Well, a number of other questions here. I want to make sure that we cover as many as we can along the way. Julie, I have a couple of questions for you, if I can, that are just specifically related to kind of the operations component for business, and they're related to enforcement a little bit. But do you have any advice from an HR perspective for employers who have employees or clients who refuse to wear a mask because they claim to fall in one of the protected categories? How, what are some things that employers maybe ought to be thinking about right now to handle some of the competing liabilities that exist based on what we're learning?
Yeah, I think that's a great question. And employers, from an employee perspective, employers can request medical certification to support that type of request from employees. And we've been pretty effective in working remotely. So working from home for us is a pretty decent option and an appropriate accommodation if an employee is unable to wear a mask. Obviously, our environment is different, and that some employers may not be able to accommodate a work from home, especially in manufacturing. So if that's the case, you'd have to, obviously, if the medical certification indicates that they cannot safely wear a mask and it is required, they could, take that medical leave or apply for disability to be off of work or an accommodation for a period of time until that requirement is no longer needed. We've also, with regard to our clients and experiences with that, we've been pretty creative with our clients and found a large amount of work can be done virtually with some modified processes. So we've been more innovative in how we do and interact with our clients as well as our employees. So we do have, some employees just in general who are at a higher risk even for returning to work, not even considering the masks. And we've been able to get creative with the work and how and when they work in order to accommodate. So that's how we've been doing it in our facility.
Have you seen a good, or would you recommend any particularly good external resources or guides that you found to be helpful in your decision making, Julie, that maybe others could take advantage of too, as they're thinking about compliance with a variety of new kinds of dynamics?
Yeah, we have, it seems like a laundry list. We take a little bit from here and there, but a big one, we obviously utilize the CDC website and resources extensively. We also we have our medical broker who has extensive resources in which they've been able to share with us. And then our medical provider has websites. So like Anthem Blue Cross Blue Shield, they have information and supporting resources, and they've been able to help with some additional questions and prevention tips and things of that nature. From an HR compliance standpoint, the Society for Human Resource Management, or SHRM, has been helpful. I lean heavily on Gartner for a lot of my information and resources, as it provides some good, the strategies for accomplishing it, as well as what other organizations are doing. And then lastly, we use Mercer extensively for some additional what other organizations are doing and just get, pulse and updates. With regard to the disease, we obviously follow U.S. Department of State travel advisories and things of that nature, and Department of Homeland Security for international travel restrictions as we formulate our guidance to our workforce. So, and then for external resources, bkd.com. I mean, we have a COVID resource center and recovery dashboard that we work with our clients on, and it's available externally as well.
That's great. I mean, that's a tremendous resource, even for things like employee travel and especially personal travel. Like, how do you manage that? How do you try to keep everybody safe while still recognizing that you don't control where your employees go in their own time?
Right. You don't want to be micromanaging by any means, but we have a number of people who are traveling, and we'll work through like their coaches. And so we handle those on a case-by-case basis. If an individual has traveled to an area with a high degree of cases, we may require that they work from home for a couple of weeks following their personal trip. We're looking at these situations really individually and find that our employees are really cautious, and their understanding of the need to share information back with us. Again, I don't think that they look at it as Big Brother trying to, impose on their personal life, but yet a way of being able to partner with us in this process to make sure that we're tracking and keeping the workforce safe. So we haven't had any issues on people not wanting to share. A lot of people are coming forward saying, oh, hey, I'm traveling here. This is the environment I'm going to be. I'm at a personal house. It's a gated community or whatever. And so we're working on those situations on a case-by-case individual basis and partnering with that employee to determine, hey, should you self-quarantine when you return, or do we feel that you're in a pretty safe environment that there wouldn't be a need? So again, case-by-case for us, but it requires a lot of interaction with team members and coaches individually.
Thanks so much, Julie. A couple of other quick questions related to the masking ordinance. I'm going to come back to that because these keep coming, and so I want to make sure that we're catching as many of those as possible. Is there? I don't remember seeing anything about a religious exemption, but this is a question that we received. If someone claims a religious exemption, is that part of? Is there a religious exemption to the rule, and if so, is there anything a business needs to do to confirm that, or anything like that? Or I can't remember seeing a religious exemption in it.
There's not an exemption that specifies religion. I guess I would be curious about
I can't think of anything. Yeah, I can't think of what it would be. So here's one related to a drive up or drive through. If you're running through a drive through fast food restaurant and you're in your car, are we supposed to be wearing masks for that interaction or in your own car? Is that considered a non-public place?
In your own car, I think, would be a non-public place.
Okay.
I would encourage people to wear masks. I do when I go through a drive-through, and I've noticed more people doing that, but it's not a requirement of the ordinance.
Okay. John, any advice on that, or is it? I mean, I haven't really had. It's one of those things that has evolved as we've gone through this time.
Yeah, and I think what's important to remember that masking we know does help. And that from an individual level to a community level, and we're hopeful that we'll begin to see the results of more people masking over the coming weeks. But I think it's also important to remember that it's one component of an individual's response and a community's response. So while there's a lot of attention right now on masking, it's an important component. I just don't want others to forget about some of the other things that are important as part of the response, such as social distancing. We don't want people to throw masks on and forget about that 6-foot distance, and that's going to help prevent the spread of transmission, or simple things like washing hands, and really thinking about how they move through the community. So it's certainly an important part of the response, but it's also not going to be our magic bullet in terms of it alone is not going to turn the tide. It's going to be an aggregation of a lot of things.
You know, one of the things that we get a lot of questions about, and I think one of the real challenges and even areas of concern for many businesses is just the uncertainty around how we make decisions on this, and those decisions have enormous implications on businesses. When we had, for example, the stay-at-home order, the economy was very healthy when that happened, and so we got through it. It hurt us, no question about it, from an economic standpoint. But we're not in that same place today. So a similar kind of a move, which is starting to happen in some parts of the country, would be much more devastating today than it even was the first time. And I think a lot of the fear that we hear from people, a lot of the concerns, has to do with can we get some clarity on some sort of agreed upon criterion for when or why we do what we do. And I know that sounds easier probably than it is, but one of the questions that we received is there some kind of a metric or trigger point related to number of active cases or active hospitalizations or something that we can be watching or should be watching? You mentioned the dashboard, John, which has good information on it, but there's some curiosity about how we're actually using that data to make decisions. At what point do we move toward further reopening? At what point, if any, would we move back on further restrictions or closures or hopefully not, but stay-at-home orders or any of those things? Is there something that the business community and the others in the community can be watching to say, okay, this is getting close to a problem, or this is getting better and it means we get to reopen the next step, or whatever those things are? How can we add just a measure of clarity to this?
Sure. So, and you're right. It is not a nice, clean answer, and that's because there's so many things that go into, I think, the community's response. We can't really look to one or two or even three key indicators and say these are the ones, because there's so many factors that go into it. I would point back to that dashboard, and I think that those three dials that we would look at: the hospital capability, the public health capability, and the testing capability scores, and where those are with regards to our community response and the spread of disease. I think those are three important sort of pieces of the mosaic, if you will, that give us information around that. And a severe depletion in any one of those scores represents a lot of those other things. So if we look at public health capability right now, it's so low because our case count is so high in the last couple of weeks, and because we've got so many in quarantine, and because we've got so much community spread going on, and those three things make up that score. And so I think when the community is looking at really what should we be looking at, I think those indicators have actually been a pretty good litmus test for us to figure out where that sits. Now, with regards to the triggers, I know that's something we're continuing to evaluate and figure out. Is there some combination of certain indicators that we can say here are the most important ones? But in terms of also using that to predict now is the right time for us to move forward, I think that they're important pieces of that, and that helps inform the community and it helps inform the policymakers on where we sit with it. But we have to take into consideration all of those things. So even if public health recovers, if hospitals start to go down, or if testing is no longer available, those are all important components that we have to take into consideration in going forward with this. And the other thing that I would just want to stress is that I understand that all of these steps and all these sacrifices are incredibly painful and challenging for us all. But I think the more proactive we are with this, the better off we're going to be. I think when we look at in other parts of the world that have sat back more on this and have let the disease run, they've suffered pretty significantly. And so I think the more proactive we stay, the better chances we have to recover more quickly from it.
Well, I'm very, very grateful for the work that you and the entire team and all of you on the call today have done to try to help us get through this unprecedented time. One of the things that I will encourage you, and you know I have, John, over and over again on this, is please keep working on that, because in the absence of something that can be clearly defined, some decision metric that people can say, okay, when we get to this level, it means we do whatever it is we do. In the absence of that, fear and pressure tend to kind of rule the day a little bit. And so I'm not saying that they have in our case, but to people who can't identify why or how we make those decisions, in the absence of that, it feels like it's subject to a lot of very subjective kinds of things. And again, I'm not saying that's what it is. I'm just saying that's what it can very much feel like in the absence of those clear indicators. So listen, I just want to thank you so much. I want to thank you for the work that you've been doing and for coming on the program today and spending some time with our members to be able to help answer some of those questions. It'll help them to be ready. We do have a business community that very much wants to help keep their customers and their employees safe. I've said over and over again, I don't think anybody cares more about their employees and their customers and the businesses who serve them. So this is very helpful in helping them do what they very much want to do. And unfortunately, our time's up. So thanks so much, Rhonda, John, Julie, for your time today and for not only providing us with this timely information today, but just for your ongoing tireless efforts and commitment to keep people healthy and safe and keep our local economy open, because I know all of these things work together to do that. So thanks so much for that. And thanks to all of our members for joining us for today. Your questions, we tried to get to as many of them as we could, but if we missed your question today, or if you need more clarification on anything discussed, please do reach out to Lauren Musto and our public affairs team. That's lmusto at springfieldchamber.com, LMUSTOE at springfieldchamber.com. And just please keep also visiting the chamber website and look for chamber emails for up-to-date business, safety, and policy-related information. Just as a quick reminder, on July 29th, we'll be hosting our annual State of the State address with Missouri Governor Mike Parson, and that will be our first in-person event since the onset of this pandemic. We could not be more excited to welcome our governor of the state of Missouri, Mike Parson. We will be taking all the safety precautions necessary, including appropriate social distancing, masking, temperature checks, all of those things. So we want to make sure that we take good care of anybody who who wants to be there in person. We do have a limited number of seats available based on those social distancing requirements. So please do register on our website if you'd like to be a part of that. We also know that you have so much that you're juggling right now as business leaders, and I'm grateful that you took a little time with us today. And please know we are here for you. As you have questions for policymakers or need answers on where to track down resources or guidance, please do contact us, and we'll do our very best to get you the answers or information that you need as you press on in the weeks ahead. And not only do we want to be your trusted resource, but we also continue to be your advocates. So please do keep sharing your stories, your experiences with us so that we can relay those to decision makers as each step in this process progresses. We're so grateful for your membership. I want to thank you for joining us today, and thank you for being a part of the Springfield Area Chamber of Commerce.